Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System, broadcasting with you live from our morning media update here in the Dolph Simons Family Broadcast Studio. Today we have special guests. Robert Moser, the Dean of the University of Kansas School of Medicine, Salina, is here. He'll be working with in the area of preventive medicine, public health. And we are also joined and delighted to have back on our program Senator Jerry Moran from the state of Kansas. Today, Senator Moran apparently is out of the basement and in Washington, D.C. Senator Moran, are you out there?
Doctor, I've been out of the basement. I've been to Washington, D.C., but I got home late last night, and I'm back in the basement.
Man, you spent a lot of time in the basement.
It's a challenge when you're traveling, and as we've talked before, Raba is taking care of our grandson, and so everybody's very cautious. And having been to the nation's capital and back, every time I get on an airplane, it seems like at least the excuse is you're going to the basement.
Yeah. Well, welcome back. It is always a delight to have you. How crowded was your plane flight?
I was surprised at the number of passengers on the plane. In some ways, pleased that there's the economic activity. There was a spacing going on, and almost without exception, everybody that I saw was masked, and certainly including the flight attendants and those working on the plane, but the passengers as well. And that's now a requirement of, as far as I know, all the airlines, is that the passengers have to wear a mask.
Yep. And Bob Moser, how are things out in Salina?
They're good. You know, had a relatively period of time. We haven't had a large enough case they've had in other areas. Sorry with all the background echo. I'm not sure what's causing that.
Stuff. Understand? Does it sound okay to our listening audience? Okay.
Okay. No, it's otherwise doing well. I think, you see folks that are moving about a little bit more this last week in Salina. We haven't had as large number of positive COVID cases and are as busy at the local health center as some other areas. But when you go out in the public, you do see about 50% of folks using the face mask. So I think they're trying to do a good job of the social distancing and using the face mask when out in public and unable to maintain that 6-foot separation. So overall, I think doing well.
We don't have masks on in the studio because Dan and I are about 12 feet apart right now. Yeah. And Doc Hawk, something we're doing is working because our numbers are down.
Yeah, that's interesting, and so last week, I think we're up to 31. Our numbers of the inpatient admissions for COVID-19 have been going down. Today we are at 18, with 9 of those in the ICU. And as we had Dr. Weil talk to us on the physician update, that we are still getting admissions. So that is more of a product probably of our discharges.
Yeah, it's interesting because when we talk about our number of admissions has actually gone up somewhat. Yep. But they're younger. We've had some moms who were delivering come in and they were positive, and others. But the reality is we have fewer and fewer patients in here, which is great. We hope that trend continues. Yeah. And I think it's important to realize that COVID is everywhere. Every hospital may well have it. Most hospitals still have patients with COVID-19. But I think everybody's pretty darn well prepared. And that hospitals are probably one of the safest places.
Absolutely.
I would go so far, and then people are going to say, oh, you're just being a homer. And I am a homer. I'm a KU guy, no question. And it only took me about 15 years to say that out loud since I went to Mizzou. But I am now a KU guy when I've been here for 30 years. But hospitals are one of the safest places to actually be. And I honestly believe, and I say this without reservation, and I say this without trying to be a homer or just trying to tell everybody we're safe. It's really, we have never been safer. When it comes to infectious diseases, the things that we have in place now are really impressive. I don't think they're going to go away, even if COVID-19 goes away, because I think we're doing it right. And I think we'll have better infection control than we have ever had in hospitals. And so whatever the virus of the moment is, whatever the season is, I think we're going to be safer than we've ever been.
Yeah, absolutely. Even our clinics, and especially our clinics, because we know that most people are not that ill but have a lot of chronic conditions. You need to get your diabetes maintained and optimized, keeping your blood sugars down. If you have diabetic foot wounds, we need you to get those looked at. If you have coronary artery disease, we need you to follow up with your cardiac physicians. So it's important that the clinics are extremely safe as well and are seeing patients also.
Even our ambulatory surgery center, I mean, they just have a whole different workflow. Everything designed to make sure that people stay safe. So, Senator, lots of activity in Washington again this week. Talk to us a little bit about some of the things that are going on there and some of the work being done here in Kansas.
For the conversation about maybe the safest place to be is in a hospital, and people should be more comfortable in returning to more routine care and surgery and care that they've been postponing. I've been having conversations by technology with Kansas communities for a long time. As Dr. Moser knows, I intend to do that later today with the community of Salina, gathering community and healthcare leaders, public health officials, and having a conversation about what's going on. And the reports, I've quoted you, Dr. Stites, in those conversations about what KU says about their healthcare, their infectious disease control, the safety of returning to the clinic and to the hospital. And I indicate that, of course, every community could be slightly different than that. But if all that is true, this is the place in which it would be best, perhaps easiest, to begin our economy rebounding and getting more people comfortable and returning. And the reports have been, I talked to an optometrist in a Kansas community in southeast Kansas, and optometry was back in business. And people were making appointments. Not only was the day full, but people were making appointments, for example, through the summer months. And clinics and hospitals reporting the same thing. This week in Washington, D.C., I had a conversation with Secretary Wilkie. Robert Wilkie is the Secretary of the Department of Veterans Affairs, perhaps the largest. It is the largest healthcare delivery system in the country. And one of the things that I was promoting, again, what Dr. Stites said is we can utilize community care. So we have a major change in the way that the Department of Veterans Affairs operates. And veterans now have a choice, if their healthcare provider at the VA agrees, that they can have care, particularly routine care, but surgery as well, performed in communities across the country. And is not this a place in which it would be a good thing for that community care to increase, to be enhanced, and more veterans seeing local physicians and being admitted to local hospitals? And the Department of Veterans Affairs is in its phases of increasing that opportunity. So again, a movement toward the ability for our healthcare professionals across Kansas and really around the country to do the job that they trained to do and are qualified to do and are now working in places that is very safe and secure. So I've been quoting you, Dr. Stites, and it is what hospital administrators, it's what other doctors across Kansas are telling me, is we now operate in the safest environment when it comes to infectious disease prevention. So a piece of news and development in regard to hospitals, we have now, there was $100 billion pot of money set aside for trying to help hospitals recover at a time in which the patients weren't being seen. And the costs, of course, related to preparing for COVID-19 spread were increasing. And as of last count, with about half of those dollars now distributed across the country, we have seen almost $400 million come to Kansas just in the last month to help hospitals in their financial circumstances meet the needs of their patients and their communities. And as we talked last week, we were successful in opening the PPP program. So our hospitals that have less than 500 employees, even if they're county owned, could qualify for that kind of financial assistance, helping them keep their staff, their medical care teams on the job. This week in Washington, in particular, a piece of legislation that I sponsored and introduced with a couple of my colleagues creates a new suicide hotline number, 988. And while I wish this was a topic we didn't have to discuss, and I'm sorry that there is a relationship to COVID-19, but our mental health and well-being as Americans has certainly been impacted by the challenges of the stay-at-home orders, the change in our routines of life, and we're working to try to get more mental health professionals in place, more money being spent on mental health providers, and now a way that those who are suffering from mental health or contemplating their own death have an opportunity to more quickly, more easily reach a professional to have that conversation. And Dr. Stites, I would say that one of the highlights of the week was joining you and the KU Health System Board of Directors with a guest visit by Dr. Francis Collins. And Dr. Collins is the head of the National Institute of Health and a variety of institutes within that National Institute of Health. One would be the one that Dr. Fauci heads. Dr. Collins is the head of the entire NIH. And he joined the board by phone to commend and compliment and to encourage the healthcare professionals, the leadership at the hospital. But one of the things he talked about, and I thought you might report on, is what he sees. I should add this point. He is in charge of the efforts to quickly develop and test and put in front of the American people a vaccine for COVID-19. And I was curious and interested in knowing what your takeaway from what you heard Dr. Francis Collins say.
Well, thank you. And first of all, thank you for your efforts for all of us here in Kansas and quite honestly throughout the country, Senator. We sincerely appreciate you and all the hard work you've done. Yeah, I have to tell you, every now and then you get kind of emotional around COVID-19 and the toll it's taken. When the head of the NIH says, we may have vaccination in October, I started to cry. I mean, and I'm not, okay, I'm a crier anyway at movies and stuff like that, or even emotional commercials. But the truth is, that's a big moment. And he said that he thought there would be 2 vaccines that might be available because they're doing something very special. They've been through phase 1. They're now melding phase 2 and phase 3 trials. So phase 1 is sort of a dosing trial. Phase 2 is sort of a safety trial. Phase 3, you get into widespread, is it efficacious trials. They're taking some of those phases, they're putting them together, and by doing that, thought that they would have results out. The trial enrolls in July. They think they'll have results out by September, and then they would be ready to start distributing doses of the vaccines in October. And there are 2 different candidates, one that comes out of Oxford, England, and one the NIH has helped to develop. And I think they've already been through animal testing, et cetera, and had some good-looking results. That is a remarkable timeline and a lot faster than we originally heard. He also said that he thought, because one of the questions you have is how do you mass produce vaccinations before you know if they're going to work? They've already started on production of some of these so that if in fact they are efficacious, they're ready to go. And they could have 10 million doses ready in October, 100 million and to 300 million doses really by the first of the year. That's a game changer. Cross your fingers, hope it's true. There are a lot of things we think are going to look great and then they don't. But Senator, man, you've been working with the NIH for years. I mean, you're a huge proponent. You helped us with the NCI designation. I mean, I thought that was a remarkable moment.
Well, it was very encouraging, but I wanted to know from the practitioner and the scientist, the man of medicine, if it was as encouraging as I thought it sounded to me. And so, great to hear that report. We are putting billions of dollars into that research and development and manufacturing of a COVID-19 vaccine. I failed to mention that one of the things I followed up on this week was a telephone call with a doctor that I met on during this press conference, Jessica Calendar Rich.
Yes.
And we had a good conversation about how we can be helpful and work together to try to deal with geriatric circumstances in the state generally, but particularly how the COVID-19 is having an impact on people with dementia-related diseases and the change in routine and the isolation that occurs. And I appreciate the expertise and the knowledge that I learned from that conversation, and I appreciate this press conference getting me acquainted with such a stellar person committed so strongly to the people of Kansas.
She is great. And Senator, one other thing, just to say thank you on the issue about mental health as well. Our suicide hotline calls are up over 8,000%. That's a big number, and not a number we like. And I think there are 2 points. One, the pandemic itself is hard, right? I mean, we're all stressed by it. It's hard. You lose sleep. You have COVID dreams. Those are not fun. You wake up between 1 and 3 in the morning, as I do every day, trying to think, okay, what can we do different? How do we work this better? And start trying to make sense out of your email then. But then the second thing is just to say that one of the symptoms of having COVID-19 can be when people don't behave right. And if you see changes in behavior, that can be a symptom, Dana, of COVID-19.
Absolutely. I mean, yes, we know that it affects different organs. The brain is one of them. Mood changes are very important. We know, and we've said that since day one. It's important to monitor not only that, but the actual situations that people are living day to day also contribute to that.
All contributes. That is also great news, Senator. Thank you for that. And Bob, any specifics? I mean, you've heard a lot of good conversation now. Money coming out into central and western Kansas. You were the former secretary of KDHE. I mean, you've been in this world for a very long time. Thoughts about how things are moving?
You know, they are moving amazingly well, considering. When I was at KDHE, I guess I was fortunate. All I had to worry about was Ebola. But, you know, this is a more challenging pandemic, obviously, wider spread, asymptomatic spread, you name it. But I thought, you know, I was really amazed at how quickly our state, went to the stay-at-home, how well that was adhered to, for the most part, by many of our folks. And I think that really has contributed to dropping down that surge curve. And, you know, it's understandable, as you mentioned many times, the frustration and stay-at-home fatigue that's kind of hitting, and people are ready to kind of move into more normal. And I think over-anxious to some degree. I think we really have to step back and recognize we don't have the vaccine. We still have a large percentage of our population susceptible, and so we have to continue with all of the public health initiatives, interventions that we know work, because we've seen it work to date, and continue to be patient. But overall, I think it's been great. It's frustrating, I know, for providers in our rural settings, because we don't have necessarily a definitive treatment that's readily available. Most of it's symptomatic. It's challenging not only in our smaller hospitals, but also in our long-term care facilities out there. Just don't always have the room, the resources, the expertise to quickly move. But yet again, they've been very innovative and very flexible, which I think is in demand during this time.
Yeah. So let's turn to our media and see first questions you all may have for Senator Moran or any of us, or former Secretary Moser.
I'd like to start. Channel 9 is asking, and this may be for Dr. Moser, but what is the disease spread that Governor Kelly referenced yesterday in slowing down reopening? How is it calculated? Why does it matter? And the follow-up is, why does positivity rate matter in statistics and analysis?
Okay, Senator Moser, you're going to have some fun with this.
Wow. I'm glad I got a simple question to start with. I think, just reflected, you might remember they were really looking at 3 gates to kind of monitor how to move through the different phases. So they were looking at not only hospitalization rates and obviously the mortality rate, but also the number of positive cases. And as we've obviously expanded testing, we expect to see a larger number of positive cases, because we know there's been community spread going on. But when you see that pop, and particularly what we've seen in some of our industries in Southwest Kansas and some of the areas north of Kansas City, you have to be concerned that there's broader community spread out there, and it's just pulling back a little bit, recognizing that if we let everyone move too quickly and congregate into larger groups to move about like more normal, we're going to continue to see a pop in the number of positive cases, which again brings us back to worrying about our capacity to be able to manage that, should that lead to higher hospitalization rates.
All right, next, other questions from our media colleagues. Any questions that you would like to ask this morning before we move to our listening audience? I thought I heard one just start a moment ago. All right, before that happens then, if there's not, let's go ahead and take other questions from Nate. Or the health system questions are coming in through Facebook or Jill?
Yes, I do have one. Somebody was asking, I think this is more for Senator Moran, is there any legislation planned to help assisted livings with costs related to COVID prevention?
So, okay, assisted living situations, yes.
The answer is yes. And as we've indicated previously in this conversation, but elsewhere, I sometimes find myself mistakenly talking about hospitals exclusively. And it is much a broader issue for us to be dealing with as a matter of public policy and public health. It's not just hospitals, it's clinics, but it's certainly the senior living environment. And as we had a discussion about PPE, the personal protection equipment, one of the things that we worked with the nursing home industry, the companies across Kansas, the individually owned nursing home and assisted living facilities, is trying to make sure that they had the gowns, masks, and gloves necessary to protect their employees, the staff, the medical providers. And we've tried to highlight this more and more. And again, it's a good reminder. This question is a good reminder for me to talk more broadly when I talk about healthcare providers. And clearly, we want to care for people in those settings. They are among the most vulnerable. It's a very closed environment. And it is also important for our broader healthcare delivery system that we don't overwhelm hospitals if we allow the virus to spread within the nursing home community. So the question about what is next, is there a focus on this? Absolutely. It is the part of the conversation I had with Dr. Calendar Rich on the phone this week, but it is the efforts to get money into the assisted living and nursing home environment, the senior care environment. And when I talk about the dollars that we've appropriated, those dollars go to all healthcare providers that receive Medicare or Medicaid payments, and that then picks up our nursing homes and assisted living centers already. But we are now working on, first of all, the initial question is, should there be a phase 4 of congressional legislation to deal with COVID-19? My guess is that issue will be resolved favorably, as in yes. I would guess it will be more politically contentious than the first 3.5 phases have been, but we are headed toward additional assistance, but also trying to fix the problems that we created or the gaps that we left unattended in our previous 3.5 phases. So the work is still underway. It's why the United States Senate, we've returned. This is the second week we've been in session. The House is yet to come back. Although there was a proposal for phase 4 introduced by the Democrat leadership of the House this week. So it is work in progress based upon the facts of what we've done and what we failed to do, and also dependent upon what the virus does and doesn't do.
You know, Senator, I'll just say I think it's been inspirational to all of us to watch people working together. That just feels good, and it feels like folks have really done just amazing work, both on the federal level, the state level, and the local level. I mean, watching Wyandotte, Johnson, Jackson, and Kansas City, Missouri come together and get things done. I mean, that. There's always all this stuff, and people play up people aren't getting along. But then to watch people get along and work together for the betterment, that I just can't tell you how much that's meant. I think to myself and to all the average citizens out here. So appreciate those efforts. Other questions? Nate.
I have somebody else who wants to know why the state has to currently stay in phase 1.5 instead of leaving it up to the counties.
Okay, Bob Moser, I think you're the best suited.
Well, again, it kind of comes back to the last question that I responded to, which is, if we use the 3 gates, number of positive cases, the rate of, what's that looking like? How quick is that going up? If we look at the number of hospitalizations and we look at the number of deaths, So if all of those are going down, I think we can be a little more comfortable in kind of resuming a little bit more of our normal activities and interactions. But the fact that we are seeing definitely a rise in the number of positive cases overall, and we know there's community spread, there is concern that while the numbers, as Dr. Stites, city, metro, the hospitalization rates and such are continuing down, we're still early in this. You may remember the incubation period can be anywhere from up to 14 days. So we're really finishing up our first week of this opening away from the stay at home. So it's always a little early. We're always looking backwards, as Secretary Norman talks about, and he's absolutely right. We have to kind of wait for the numbers to catch up to really identify what's the impact of any of these changes in our phasing. And so I think they've just seen some pop in the numbers enough that it worries them that if they don't slow down just a little bit, that we may be back concerned again about what's the surge impact going to be on our local hospitals. And with any surge in our hospitalizations, of course, that means a possible increase in the mortality rate. And we'd obviously like to keep that as low as we can.
And I think it's important to note that because Kansas sheltered early and did a great job, the curve was really bent, Dana. Mm-hmm. And as a result, by doing that, we kind of got this sense that, okay, we got in front of this. But COVID or SARS-CoV-2 isn't gone. It's still out in the public. Right, and the risk is as we open things back up, especially places where there's group gatherings. That's really the key. It's not just that one individual goes out, although that can be a risk. It's really about those group gatherings, youth soccer leagues, youth baseball leagues, youth football, gymnastics. You just go down the list. You think, oh, okay, I got to watch it. Schools opening back up. I know the universities are trying to determine what they should do. And then even look at things like churches and other places where even older populations may be who are even more susceptible. And if kids get sick, where do they go? They go back home. But they may not even have symptoms, and yet they can give it to their parents or to their grandparents. And that's where the chain begins to worsen again. Yes. And that's why it's so important to look at the number of positive tests. If those start to rise, the alarm bells start to go off. They go, okay, are we just finding more because we're testing more? Are we finding more because SARS-CoV-2 is beginning to achieve liftoff again, which could mean bad news? So thoughts about my long diatribe there.
Yeah, absolutely. And hopefully, if those numbers are going up, one of the things is that we are testing more. We have the media, we have the nasal swabs, we have the capacity to do the testing, especially in the contact tracing as we move forward, and that's going to be a very important part. So hopefully we've flattened the curve enough, we've got our supply chain so that if there is a surge, our providers and our patients have the proper PPE to protect further infection, but also we have the testing supplies and the supply chain to do that so that we can do the adequate contact tracing and get those things done. So that's all very important for sure.
And I think that adequacy, just to come back to our earlier point, but it is safe to go get care. If you think about that, our normal census here is around 700 and 750. We have 18 patients today with COVID in it. So that's like 2 or 3% of our population. Those folks are cohorted. We keep them safe, and we keep everybody else safe. And in fact, your clinic experience is going to be much different than you've ever had before. Even as an inpatient, your experience will be much different than you've ever been before because of the amount of PPE we're devoting to each and every patient just to make sure that people do stay safe. And I expect out in Salina, you guys are doing the same thing, Bob Moser.
Yeah, absolutely. While their numbers have been low, and speaking with Dr. Rob Freelove, the CMO there at Salina Regional, they still worry a little bit about the PPE supply. We're anxious, obviously, as School of Medicine, to look at when we can start reintroducing our students back into clinical settings. But I agree completely with you. I think we're reaching a point where keeping them out of clinical settings and in the community, they may be at higher risk of being exposed to COVID than actually being in the clinical settings, taking care of patients and learning. But we're going to wait until we're pretty comfortable that we've got an adequate PPE supply. We won't be putting students and our patients or the health system at risk.
You know, the question about what are students doing will be covered on Monday when Executive Vice Chancellor Rob Samari and Mike Kennedy, Associate Dean of Rural Health, will join us. So that wasn't a planned comment, but thank you, because it gives me the perfect segue to go into that. But Rob Samari is a good friend and does a great job as our Executive Vice Chancellor. And we'll talk about the changing face of medical education, because this disease has changed it, and how has telehealth and how has telelearning affected that, as well as what are those 50 students that Mike Kennedy was here talking about before. What are those 50 students doing out in the state of Kansas trying to help ease the burden of COVID disease? Other questions out there?
There is one.
Please.
A community person is writing and asking, I've been invited to a party this weekend at a neighbor's house. Is there any safe way for me to attend? And should I tell my coworkers when I return to work?
Oh boy. Party at a neighbor's house, Dr. Hawkeye. What do you think?
Well, my initial thought would be
no.
If you can maintain and be outside, no, but yes. No, I think the ultimate answer is probably no, but is that party outside? Is it just going to be, I don't know, 4 or 5, 6 other adults who are outdoors and separated by 6, or I would say even 6 to 10 feet?
Yeah.
And that can be done
with
easily,
masks on.
Much more easily by adults than children, obviously. I think the ultimate answer is right now, it's probably no. But again, there are things you can do to mitigate those risks, and we've talked about all of those things. You really can't control other people. You can't control who's in their household. Are they sick? Are they pre-symptomatic? Wear masks, do hand hygiene, don't share drinks. I think the ultimate answer right now, the optimal medical answer would probably be no.
Yeah, I think it's just hard. Senator Moran, tell us about some of the things you've had to do in Congress to help stay safe.
Thank you, Doctor. It is an odd place. It's always an odd place, Washington, D.C., but again, the House is not in session. There's 435 members there. There's only 100 senators. Our votes have been extended. We now never take more than one vote in a series. So there are no series of votes, only one vote at a time, so that and the amount of time that's allowed for every senator to vote has been doubled, meaning that there's supposedly only a handful of folks on the floor at any given time, the floor of the Senate chamber. So you come in, you vote, you leave. There's no lingering and a lot less congregating of members, making it much more difficult in a sense to do our jobs, in which the conversations, the discussion, the back and forth, what are you thinking kind of conversations are much more difficult to have. And our Senate lunches, many have been now changed to be a telephone conference call. And the times that we do get together for lunch, we are in a large, more like auditorium-size room with tables spread throughout the room and only a couple of senators at a table. So it has changed dramatically. I have not seen my staff in my office for 6 weeks. They are home working, telecommuting, and committee hearings. I participated in 2 committee hearings this week. One in the Banking Committee, in which we had the Federal Reserve, as well as the Office of Comptroller of Currency, the FDIC, banking regulators, and fiscal and financial policy experts, all done by the witnesses, generally done remotely, and done by me from my office, where I'm the only person in the office, and using technology to listen to the hearing and to ask the questions. The second hearing I would highlight for purposes of this conference, it was the Commerce Committee having a hearing with telecommunication providers, internet providers, on the state of what we have learned from COVID-19 and our experience with technology in trying to meet the country's needs. And I've been, for as long as I've been in, perhaps it's the rural person in me, but for as long as I've been a member of Congress, been advocating for policies and resources to help spread the availability of broadband, especially in rural places, but also in the inner core of cities. And COVID-19 highlights, while I know we've made progress, it certainly highlights the gaps that still remain. And the ability to do the things that you just were talking about with telehealth is determined by a couple of things. One is the broadband interconnectivity actually in existence? Is it a high enough quality that it works? And secondly, do we have citizens who have the financial and technical capabilities to utilize the devices to connect? And so a takeaway from COVID-19 and healthcare and education circumstances in Kansas and across the country, a takeaway for me is redoubling our efforts to try to make certain that telecommunications, internet connectivity, and access is increased quickly. And it does do, in your world of distancing, it's a way that we distance.
Yeah, I think that it makes such a difference, too, because when we try and provide telehealth out to western Kansas now, that limitation becomes apparent. And so all the work that's being done there is just terrific. And I think one of the things that feels like, and Senator, please feel free to comment on this, is that there's been a little bit more of a look on infrastructure again to help with making sure that people who live in either rural areas or very urbanized areas that perhaps don't have the same level of connectivity, that there's a lot of work on infrastructure being done in this environment.
That is absolutely the case. I mean, the Department of Veterans Affairs, for example, we gave them specific authority to enter into agreements with telecom companies, with internet providers, to increase their capabilities of dealing with veterans who live far away from a VA hospital, but also perhaps far away from their community provider. And again, those services need to be much better utilized. And in order to do that, we have to improve the availability. And that, the private sector, it's a challenge for them because there's little or no money to be made by providing internet services in places that are very remote and the population is not dense. You make money in volume, and many places in Kansas, and particularly the part that Dr. Moser and I come from, are very sparsely populated, and therefore there's not the incentive for the private sector to fill that need. And government has played a role in that regard for a long time, but we haven't been as successful as we needed to be. And the FCC, the Federal Communications Commission, and the Department of Agriculture, through its Rural Utility Services, have grant programs, and we all pay for this in part through something called Universal Service Fund, which we pay on our telephone bill, designed to initially bring telephone services to places across the country, now more designed to bring internet services across the country.
Yeah, such good stuff. Any questions from this morning? Nate, Jill, anybody?
Nate's got a lot.
Nate?
Sorry, it took me a minute to find my mute button. So I did have a couple. One person, well, I have several, but let me see if I can get you a couple you can answer. I have one person who said that she tested positive for the flu in January, but she believes all her symptoms were that of COVID-19. So ultimately her question is it possible for COVID-19 to give a false influenza positive? And then another person was asking how long can the droplets remain in the air, because they read that they could be in the air for up to 14, 15 minutes.
Okay, Dana. Can you get cross-reactivity between the flu and COVID-19? I've not heard that.
I don't think there's any evidence. They are two very distinct viruses. We know we've talked about cross-reactivity of antibody tests to SARS-CoV-2 and other common coronaviruses. I am not aware of any cross-reactivity of the influenza tests with SARS-CoV-2. It is certainly...
And part of that is because the viruses are just very different. And how the test works, it looks for the DNA or RNA or pieces of the virus that's pretty specific. So unless you're not doing a good job on the test, there really isn't a lot of cross-reactivity.
Those are so specific, yep.
And by the way, influenza will make you feel terrible. And just to say, COVID-19 and influenza, the symptoms are not dissimilar at all. In fact, they're pretty darn similar. So if you tested positive for the influenza and you think, well, I have symptoms of COVID-19, the reality is you had symptoms of influenza, you tested positive for influenza, you probably had influenza.
Yeah. And, at that point in time, we were saying, well, there's only probably a 2% co-infection rate, so that's a pretty small rate. Now, as we move further and we get into influenza season, with our
That may
experience here in
change.
the United States, we may actually see higher rates of co-infection with those viruses in other common cough and cold viruses.
And the thing about vaccination, and again, I want to return to the Senator's comments about the things we heard from Dr. Collins, from the head of NIH. That is a pretty big deal that we could even get vaccination in this late fall, early winter season, because that would be concurrent with influenza. That's a really important thing. And remembering that how vaccination works, normally what happens is you get a piece of the killed virus, and so your body begins to get immunized against that, and so then as a result, when you see the virus again, you're ready to fight it. So it works pretty darn well. Nate or anyone else? Senator Rand's going to have to pop off. So are other questions for the Senator?
I was looking. I haven't seen. There was one person who was asking if there are any tips on how to receive their stimulus check. I guess they have a son who lives in Kansas who hasn't received it yet, but I don't know.
Senator, any advice around that?
Yeah, I mean, that is a common. We actually hear more about unemployment insurance benefits, which is a state issue, but we get a sufficient number of calls from individuals waiting for their stimulus check. This is the check that every individual who has an income under the $75,000 is to receive. The issue has been that if you filed a tax return in in 18 or 19, you're in the system. If you didn't, then it's a slower process. And so we've had those who have not filed those tax returns. These are people who often, it's not people who are legally not filing a tax return. It's people who might be on disability or their income is veterans benefits. And there is a portal. In fact, you had to sign up by this week in providing information. But the easy answer for me to give is make sure you contact our office, and we will go to bat to try to figure out that we have hundreds of these. I don't know what the number is. We have many of these instances in which we're trying to help a constituent get what they are entitled to. You're right, Doctor. I'm going to have to leave the show, but I want to compliment Dr. Moser, who I've known as a physician in Tribune for a long time. KU picked him up and took him away from the community, but he has been taking care of Kansas, and particularly rural Kansas, for a long time. I toured and visited the KU School of Medicine in Salina several months ago, maybe early this year, January. And what a great opportunity, certainly to see Dr. Moser, but more important and significant in my mind, what amazing medical students you are training and educating there, and what a commitment they have to Kansas, and especially rural Kansas, which is so pleasing. And I'm glad the state of Kansas, and particularly the KU School of Medicine, decided that if we train and educate physicians in a place like Salina, which to some of us is more of an urban area than to others, but if you train and educate them in Salina, the likelihood of them practicing their profession in the places that are most underserved in Kansas only increases. And I love the commitment I heard from the students. I think in this case they were all female, all grew up in Kansas, and all had a passion to continue to serve their state. I love that, and I thank Dr. Moser for his leadership. One of the things that I caught in the press this week that did not come up in today's call that I thought might, and again, I'm departing, but I would raise the topic, and maybe it's a conversation for a different program, but at least the Wichita Eagle, which I would suggest which I think suggested probably the Kansas City Star, covered the story of the racial disparity in COVID-19. And I'd be interested in hearing in the future the take on why that is. The point that was made in the article is that, and I'm quoting, nearly a third of the state's COVID-19 deaths have been Black Kansans, although they only account for only 5.6 of the state's population. So I leave you with a major personal and policy issue and a request for us to figure out how we care for all Kansans that face the challenges of COVID-19.
Well, Senator, I think we just came up with a topic potentially for next Friday to explore. And it's one we've had a couple of the opportunity to talk to a little bit. But I think if we look at it more from a policy perspective and some of the underlying reasons, we were just simply kind of reporting on the event. But I think that you've just challenged us, and we'll rise to that challenge. And fortunately, we have a couple of people on our campus here who are really spending a lot of time on this issue and working on it. So thank you again, Senator, for being part of our program. We look forward to having you back, and good luck in the basement. Say hi to Raba, and thanks again for all you do for us and for the state of Kansas. So appreciated. We lost Bob Moser a little bit ago. I think
all three doctors, thank you.
You bet. We lost Bob Moser a little bit ago, I think, because he got the hardest questions. I think he was probably thinking, I'm done. No more hard questions for me. We're probably going to wind up this morning. Dana, any thoughts here as we go into the weekend?
Yeah, I mean, I think there's a lot of lessening of the restrictions, opening up going on. Please don't go out if you're ill. Remember to practice good hand hygiene. Don't touch your face. If you do have a cough or sneeze, please do that into your elbow or your shirt. Remember, you don't have to be going out to other places where there are gatherings. It might be bad weather, drizzling, but you can still get out and do exercise. And that will also help with your mental health, your emotional health. So get out and walk if you can. It may not be as crowded now because of that. So I think those are things to take into account as well. Continue to keep yourself healthy and do those types of things.
All right, I get my 60 seconds of raw honesty. So I want to go out. I really want to go to a restaurant. I tore my suit jacket. I need to go get that fixed. I'd like to get another one. And I'd like to just make sure that I'd like to get back to our church. There's just so many things you want to do. And there will be time to do all of those things. You heard this morning some remarkable news about vaccination not being far away. Potentially not far away. That's a big deal. As you make your choices about what you need to do versus what you want to do, remember that there is a difference between need and want. We all want to get back out there, but we have people we love and people we care about and who care about us. We have families and parents and friends who mean a lot. When you take care of yourself, you take care of all those folks too. So make good choices, stay safe, and remember, there's still no place like home. We'll see you next week.